Aloha, everyone, and welcome to another episode of From Anxiety to Clarity. I'm Beth-Ann Kozlovich from Sutter Health Kahi, Mohala, and I want to thank you for joining us for this series brought to you by Sutter Health Kahi, Mohala and Brain Gain Hawaii, with many thanks to the Leong family, especially Koko, who engineers for us every week. So, where are we this week? Well, as we are approaching the end of September and going into October, at least Oahu is now lifted from its stay-at-home order, and people are able to move about, although there are many, many restrictions, as we're still in the first tier of the tiered plan that the city has adopted with the approval of the governor. So right now, people can be in groups of 5 at the beach, taking a hike. Other places, restaurants opening to 50% capacity, same thing with movie theaters. We've got, again, the malls and retail opening. Many things happening. The dog park is open, all kinds of good things, but people have been dealing with a lot in these last 6-8 months coming through COVID, and it really will be seeing what happens as we go into this next phase and whether we will see cases spike again, which is what brought us to the second shutdown. So at this point, we're really looking to people to understand that they have a lot of control over how we go forward and hoping that they take that control. So hopefully we can move in the next month from tier 1 to tier 2 and hopefully to a place where we can reopen much more fully. Although on October 15th, we will have the pre-travel protocol for those who can get a test and get it within 72 hours before arriving to be able to welcome some visitors back to Hawaii. So in a nutshell, that's where we are. But today we want to take a look at where some of us are at a very, very deep level, at the level of breath. And to help us do that, we're very happy to be talking with Pedro Haro, the Executive Director of the American Lung Association in Hawaii. And thank you so much for making time, Pedro, for being with us this morning. Good to see you.
Yeah, good to see you. Good to see you, Beth-Ann. Good to be talking to you in this format. It's been a while.
It has been and in this case, it's from my living room to yours.
Yes.
And as we're all moving through COVID, COVID has a very special relationship to your organization because, of course, American Lung Association, people may forget, COVID is a lung disease, and what that means for the very simple act of breathing for a lot of people. We know that with all the other symptoms, but one of the basic ones is that inability to breathe fully and to have it really impact the cardiovascular system. So let's talk a little bit about first how you're doing. How are you doing with all this now that you've been working home all this time?
Yeah, it's, I talk about, I like to mention that I took over full time as Executive Director of American Lung in February, and I had enough time to set up my office and then pack up and work from home. And I thought, it's like, I sure know how to pick them, being the head of a local lung association in the middle of a lung pandemic. But it's amazing. I talked to my mom about that a little bit as to how funny that is that it played out. I said, I couldn't have picked it at a worse time. And she said, no, I think you're wrong. I think you're exactly where you need to be.
I think your mom is right.
Yeah. And it's been, fortunately, I had a setup working from home. This is my home office. But I understand, how difficult it is for other people who are transitioning, who are having to set up those spaces in the drop of a dime and trying to figure out how do you move, how do you even know what you need on a day-to-day basis? Obviously, offices are still there and you can go back and forth if you need to and pick up this or that, but just the upending of your life, whether it's working from home, losing your job, not being able to see family, life going on in the situation, birthdays, etc. It's a lot for anybody to deal with. It's so much for everybody to deal with. And whether you feel it yourself, whereas, I'm set up perfectly fine, seeing others in stress causes you stress as well. Seeing other people suffer causes you suffering as well. And so, that's been the difficult part for me, is watching my family, loved ones, having to deal with unemployment, having to deal with, figuring out how exactly they're supposed to be doing school, for their children, etc. All of that is, it's vicarious, vicarious trauma that we're experiencing as a society. And, whether you're personally affected or not, you are affected. All of us are.
It compounds, and in many cases we don't realize how it's compounding. And for anyone who is already dealing with a mental health issue, or let's just call it mental illness straight out, this can be an even more difficult situation, or as some have suggested, because they're already dealing with it, that it may also be a situation that they're better equipped to handle. We've been talking to mental health professionals now for all of this time since maybe April or so. I know we've done about 22 episodes or so. And what we hear is both sides of that spectrum. People coming to mental health for care for the first time because they're realizing in all this how much they need it, and others who are doing well because they've already been plugged in. So as you have been dealing in your past with anxiety and depression and PTSD, how has this area been for you? And I don't want to tread too much on your personal life, but because you're pretty open about sharing that, as you're looking at your own mental health in the world of COVID, how has this been for you?
Yeah, and that's even another one of those areas where, I had a running start because I had gone to a mental health professional ahead of any of this happening. But it started, going in the middle of my bachelor's degree many years ago, where it just felt like I couldn't breathe. And, it really brings it around full circle. And I could understand that it was anxiety, that I was anxious, that I was worried. And I think that then when it's situational, and that's what people, sort of, get stuck in that trap, is that when it's situational, that you think, well, I have these tests or I have these things, then it's normal to feel, anxiety or pressure or those kind of things. And that's what college life, quote unquote, is. But it's when you are not able to handle it, or the tests are over, and you continue to feel that pressure, you continue to feel that stress, that anxiety, that inability to feel like you can take a deep breath, figuratively and physically. I went in to see a doctor who referred me to a psychiatrist, and in the process of that, was able to diagnose me with depression and anxiety. But the really pressing issue, which is a lot for us, is that anxiety thing, because that feels like, for me, I felt it in my stomach. Different people feel it in different parts of their body, obviously, but for me, it was in my stomach. It just felt like I couldn't breathe out. And one of the things that, we talked about with the psychiatrist was how that inability to breathe was my greatest symptom. And, because he was a medical doctor, he started looking at my medical history and said, "Oh, you have a history of sinus infections." Like, "Yes, I do." I think, "Oh, and do you have and he looked at my history and said, "Oh, you had a broken nose. And do you know if you have a deviated septum?" I said, "Oh, I don't know that." He says, "Oh, what about allergies? Have you ever gotten checked for allergies?" I said, "Oh, no, not really. I mean, I'm always sort of sniffling. I mean, that's just the way I've always been." And, we talked a little bit about that how many adults are going on with allergies or deviated septums. And that's just how I breathe. That's just, normal for me. But we realized that one was aiding the other, and it was a chicken or an egg thing. We weren't sure if my anxiety would be triggered by my inability to breathe because of allergens or my deviated septum, or if my anxiety got worse because of my inability to breathe, and so that the anxiety would feed off me not breathing, or that me not breathing fed my anxiety, back and forth. So it was really important for me to take care of my nose and my allergies, and that seemed to have a really deep effect on my anxiety, along with mental health treatment. And I did go through therapy and all of those types of things. But it's amazing how our bodies just, perceive danger and has these automatic responses to those stimulus.
You're really making the point that not only can one thing feed the other, but they're parts of the same whole. We want to very often bifurcate ourselves. Well, the health means physical health. And now we're really seeing how much health encompasses mental health. And so I think with you, you could be the poster child for that in what you've just said. Because you have these understandings in your own life and with other people and your family, how has this been for you in now being the executive director of ALA in Hawaii, in approaching other people about the simple act of breathing and what lung disease is all about, particularly as now we're coping with lung disease within the framework of COVID?
Mm-hmm. Our tagline is, when you can't breathe, nothing else matters.
That's
and
right.
Particularly this year, that has taken on a huge significance, right? So not only are we dealing with COVID, we're dealing with, social unrest. I can't breathe has become the calling symbol of people asking for reform, police reform, and other types of social justice reform. So it's in saying that I feel like I'm in the right place at the right time. It couldn't be more true. I started out the year talking to people about the flu vaccine. A lot of people don't realize that the flu is also a lung disease. So that's one of our large campaigns for the year. Oh, you have a little visitor. Did
Binky just move behind me? Yes, I see him going up the stairs.
And so I started the year talking about, to my family, to everybody who would listen, about the flu vaccine. And talking about, we could see COVID coming in the horizon even as early as January. I was talking about how you don't want those things to compound. You don't want this possible new disease coming in at the same time that you had the flu.
The twindemic, as people are referring to it. Yeah. Exactly.
And I just, at the time, I felt like, good prevention. We don't want to be stuck in this. But it has now changed from, this sort of fun little campaign to make sure everybody has their flu shots, to a life-saving message that we're talking to people and so that onto itself, the calls that I'm getting are people who are now dealing with family members who are in the hospital. And the call that I get most often is, I can't reach my loved one, and everybody's so busy at the hospitals, and I can't be there physically to talk to a doctor or to see how my loved one is. Is there anybody at your office that can help guide me through that conversation, that can help do that? And that's what most people are looking for, is I just don't understand what's going on, and I just need somebody to help me understand my particular situation. And I think that you find some of those similar themes in mental health, where people are saying, I don't quite understand these emotions that I'm having. I'm tired, but I didn't really do anything. I'm scared, but I don't know why I'm scared. I'm not scared about one particular thing. I'm not scared about getting COVID, but I think I am. And so, the same way that we talk to people about their lung health, it's so important for people to seek that advice from a healthcare professional, a mental healthcare professional, to be able to understand those complex emotions. Otherwise, I don't understand how we get through this without getting that specialized help that would be able to clear for us, this is what's going on with your lungs, this is what's going on with the feelings that you're experiencing, and validating that what we're feeling are normal emotions.
When you say that people are talking to mental health professionals to deal with some of these ambiguities about what they're feeling and how they're feeling, it doesn't necessarily have to be just a mental health professional. The mere fact that people are asking you, and I don't mean to say that you're not a mental health professional, but I mean not going to someone who is a clinical therapist or a psychologist or a psychiatrist, but to be able to just connect and talk about those feelings, and the fact that you are there in that capacity for people, which is maybe a little bit outside of what ALA has strictly been doing over these many, many decades. But that speaks to where we are as a society and what we need to do in understanding that, again, this is all part of a whole. It's not all segregated in nice little boxes in the way that perhaps we thought it might have been, or the way we tried to organize it so that we could approach it more fully. Really, it's making the point of how complex we really are as human beings and how much we need each other. And that in some ways runs contrary to what many of us have been told, that, you know, you need to be a self-starter, you need to be a self-motivator, you need to take care of yourself, be very individualized, all of that. I think we're getting a big lesson in interdependence, particularly when it comes to health-related issues and how we are fully integrated human beings with both mental health and physical health.
Yes, and it's important to note that, because none of us live with just our lungs or just our brain or just our heart. And a lot of times, you know, when we're in public health, we behave in that way because that's our job. That's what we mean to do. But none of us, none of the people that are our clients, nobody that you're seeing at Sutter Health, nobody that we're seeing at American Lung Association is solely only living within the scape of what the services that we're able to provide, right? So it is important for our different disciplines to talk to each other, because our bodies are talking, you know, to other parts of their bodies. So I think
all
it's
the
really
time.
important. Exactly. And I mean, for lung health, you know, when we look at people who have COPD or other types of breathing issues, it's very common for them to be diagnosed with anxiety, to experience those anxiety symptoms, because the way that your body interprets not being able to breathe, it's panic. And so you have deep set anxiety. And so if you're already a person that's dealing with COPD and have lots of stress and not a really good way to cope with that stress, then you're more likely to have your COPD be worse, because you're not able to have that oxygen coming in. Already your body physically is limiting it, and we know that the body reacts in that way to stress and anxiety as well. So it's compounded on their health outcomes. And so similarly to the way that we live in many different states at one point, you know, I think that we're learning that as health professionals, that we have to live in different states as well. And, you know, even beyond our health, that you know, the different aspects as to, you know, be dealing with quarantine, is that sometimes people don't have an extra room to quarantine. And so how do you deal with that situation? If what we're trying to do is improve lung health, but they can't do it because of their social conditions, then what is our responsibility as a state, as a organization, to be able to deal with that as well, if what we're trying to do is improve their health? So 100% right. I think that we're learning as professionals that we have to reach out more. We have to have better understanding of how the different you know, bodily organs as well as social landscape affects our health. And I think we're doing better each year. And I think that's the one positive thing that 2020 has brought, is that all of us are a lot more aware of how different factors affect us, and that there's no linear way to be able to get to, you know, to health, to be able to be well.
And I mean, that's part of the point, exactly, that it's not just integrating mental and physical health, but it's also looking at the whole issue of health equity. And for the first time, I think we're really seriously looking at that, in just the very reasons you talked about, because people have to self-isolate. And if they can't, because they're living with, you know, 10 other people, it's going to be awfully difficult. Plus, we're going to have spread. So public health has now played a very different role than perhaps it has in past, at least that people remember actively. I mean, public health has always been there, and certainly has been active in many other issues that we've seen happen, health issues. But this one has truly made us pivot in a way that we haven't been able to do before. And for a lot of people, the big hope is that these lessons that we are learning now will help us to transcend some of the issues that we've had in past with health equity, with the ability to deliver care and have people really have access to it. For what you are seeing with life and breath, and if, you know, you can't breathe, nothing matters, nothing else matters. How do you see that going forward in a way that makes sense both through public health and also in our way in which we've organized our society? What would you like to see greater emphasis, or where would you like to see greater emphasis?
Well, you know, there's something very simple, which we do the same thing that we do with mental health. And I mean, and it's important for, I think, to point out, is that previously to joining American Lung Association, I was with Mental Health America of Hawaii, and we would have very similar conversations about that mental health isn't just for people who are experiencing health issues. Mental wellness is for all of us, and we need to be able to take care, engage in self-care, regardless as to whether we think that we need to see a health professional or not. That's just the same way that we wash our hands or, brush our hair or whatever it is. Keeping our mental wellness is important in an everyday task that we should be employed in. It's a similar thing with lung health. So what happens is that our lungs have this elasticity, and there's these little tiny muscles all over our bodies that help us breathe in and breathe out. When we breathe in, we take in oxygen, but we also take in, the environmental gases that are in the air. And as we breathe out those gases, all of those negative things. But as we age, if we have something like asthma, COPD, it becomes harder to get that air out, that stale air to get it out. So it keeps getting trapped, and it also helps to contract your lungs. They're not as elastic. The one way to think about it is that little rubber thing, that little springy thing in the screen doors. So that after a while it stops sort of springing back to the way that it was. That's the same thing with our lungs, and with our diaphragm, which is a muscle. It stops working as much as it did than when you're taking a nice big healthy breath. And what that does, it engages our other muscles, like around our neck, around our shoulders, our chest. But in reality, our breathing is coming from our stomach. If you watch a little baby breathing, this is what I always picture is, if you watch a baby sleeping on its back and breathing, all you see is their belly move up and down, up and down. And you see this with animals as well when they're sleeping on their backs, and you just see their belly moving up and down. When we tell somebody take a deep breath, we usually do this. These muscles should not be moving when you're breathing. This has nothing to do with, your lungs are down here and your diaphragm is further down. Those are the muscles that should be contracted. So similarly, there's some exercises that we can do every day to make sure that our lung health is the best quality as possible. And this is something that all of us should be doing as we age, as we start coming into contact with allergens, as we come in contact with flu. The best quality of lungs that we can have is going to give us the best running start towards all of those things.
You're talking about diaphragmatic breathing, which, if you're taught that because you sing or you speak, and that's the same thing, is like your shoulders don't move. This is not a deep breath. I mean, everything that you've seen in the cartoons is wrong.
Exactly.
You need to be bringing from your stomach and your diaphragm, especially as people are dealing with anxiety and depression. And even when they're confronted by something, we say to people, just breathe, just take a deep breath, all that. The advice that we give to people when they're dealing with a very difficult situation or they don't know what to do. The first thing is, breathe. We don't know how to do that as a society. We really don't. The mere fact that we're having this conversation, and it's just not simply, oh, well, of course we know that. But really, people don't know how to do that.
Yeah.
And I'm wondering how you are dealing with that basic need to breathe and breathe well when people are dealing with things like all the lung issues, COPD, people who have lung cancer, people who are dealing with all kinds of compromised situations which don't allow them to have a full breath because maybe something else is going on in their bodies and they don't have the space to be able to do that. How do you put that into the context of, we're also dealing with COVID, and so this is why you need to learn how to breathe in the most effective way possible. Are people hearing that message?
I think people are a little bit more aware than they were, but I don't think that the message is getting through. Similar with mental health, that we're talking about self-care and mental wellness, and there's certainly a pickup, and there's certainly a lot more conversations that weren't happening 5, 10, 20 years ago. But similarly with breathing is that a lot of people don't understand. You just think, well, you just breathe. That's all there is to it. There's no, I wouldn't say there's a wrong way to breathe, but there are better ways to breathe. I mean, we all certainly breathe, and as long as you're getting oxygen to your lungs, that's a positive thing. And when we're learning about ventilators and how they're working in hospitals, it's explaining that it's essentially a machine that breathes for you because your body is not able to breathe on its own. it doesn't have that capacity. So even though we think, breathing is the most, basic of things, we're born knowing how to breathe. Your body does have the inability to make it harder for you to do that. So that includes COPD, that includes asthma, and that includes anxiety. That our body makes it more difficult for us to do. And in that same context, the simple exercises of just being able to breathe from your stomach. And so you put your hands up to your stomach. I'll move a little bit back so that you're able to see. So you just put your hands up to your stomach so that you're able to see your hands moving up and down. And if I turn to the side, you're able to see how it expands. But the trick is as well, breathing in through your nose to be able to calm yourself down, whether you're having an anxiety attack or whether you're having a COPD, a particularly difficult time breathing with COPD, is to breathe in through your nose, a nice, careful breathing, and then breathe out through your mouth, and trying to breathe out twice as long as when you were breathing in. So that gets all of that stale air out. It contracts your lungs, and then as you take in the air again, it expands them. And so you're giving them a little bit of a workout. And just like anything else, the more that you can give a little bit of a workout in that practice, the better your lung health will be. And it's a very simple message. It's a very simple thing that we can do. The difficult part is remembering in those moments, because that's what happens when we're having in a difficult situation, whether it's a financial situation, whether it's, an anxiety attack, whether it's a physical manifestation. And sometimes we forget our own advice and our own best interest in a difficult situation. So what I always tell people is the best thing that you can do is practice. Make it part of your daily routine. Make it part of making sure that when you wake up in the morning, just take those deep breaths. When you go up at night, you take those deep breaths. Don't wait until a moment is difficult to do that. You should definitely do it during a difficult moment, but you don't have to wait till that happens, because your lungs will be healthier in that situation. So whether it's dealing with COVID or dealing with anxiety, you're in a better place to be able to deal with it. It's a simple message, but again, we're human beings. We don't always take our own best advice. We don't always take, very simple things, walking a little bit extra, or, eating that healthy food. It's difficult for us or something to make those choices to spend that time. Fortunately, you can be doing this, watching TV or doing, any other things. So just that very simple message of taking care of your lungs so that your lungs will take care of you.
That could be a little more difficult when someone is wearing a mask. So then what do you advise people to do when they are out and about, as we've been told that we must? We have to wear a mask. If you're out shopping, if you are, any place in a public scenario, you've got to have a mask on your face. Depending upon what that mask is made out of, it might be more permeable or less permeable and trapping a lot more CO2. A lot of people say, I just can't breathe with this thing on. And you see people, kind of pulling it down so they have their nose above it here. And when other people come around them, they pop it back up again. But you get what they're doing. They're not trying to be non-compliant. They're simply trying to be able to breathe effectively. So how does that, how do you make that, fit into what we've been told we must do as good members of society to prevent any of transmission of COVID or anything else, flu, cold. But when people have to wear a mask and it's difficult for them to breathe and they're out and about, or they're in a work situation where they must wear a mask all the time because they're sharing an office, they can't stay distanced, it's part of the protocol of where they work. How does that fit in? What are you telling people now?
Yeah, and we've gotten several calls from people who will say, I have a COPD condition or I have asthma. Should I be wearing a mask? First and foremost is you should talk to your healthcare provider. If you have a health condition and you believe that wearing a mask is too difficult for you to breathe, you should definitely talk to a healthcare provider. In general, what we're seeing is that people who have lung conditions are still able to wear a mask perfectly fine, as long as they sort of, take those precautions of being able to take a look at their breathing patterns, making sure that they take time to breathe properly, so that they're able to take those breaths. It is uncomfortable, and anytime that we're programmed that way, that anytime that something blocks our face, we feel uncomfortable. We protect
or really
our face.
anxious.
Yeah, exactly. I mean, we're wired that way as humans, that we protect our face, we protect our head, you know, and so anything that feels like it's obstructing, it's difficult. Many people feel the same way about glasses, that have to wear them, saying, they're uncomfortable. I can't concentrate with them. That used to be for me. I couldn't stand wearing glasses, and so I would wear contacts because glasses were just too uncomfortable. Obviously, it's you know, people are able to get on fine with glasses. It was a personal thing for me. But what I also recommend to people is that when you go into a doctor, if you believe that you're getting less oxygen, because some people actually believe they're getting less oxygen, is they're able to measure that, or you're able to buy a little $20 piece at Long's or on Amazon, and that you put on your finger, and it measures your oxygen level, an oximeter, so that you're able to see whether you actually are getting any less or more oxygen. And sometimes just knowing that you're getting the same amount of oxygen, that tends to calm you down. That tends to make you feel like, oh, you know, I kept thinking that I wasn't getting as much oxygen. But if you do have a lung disease, you should definitely consult with your physician to see if, you know, what makes sense for you. In general, we should be wearing masks. That's one of the proven ways that we know that we can stop the spread. We're seeing study after study that is proving that when both people wear masks, if they're conversing, and particularly if they're keeping their distance while they're doing it, is you can really control it. That you know, people will still, you know, have the ability to transmit in one way or another, but you really control it into a much more manageable level. And this is particularly important for those people who have those chronic disease, or are elderly, or have some sort of compromised immunity. And then the last piece of advice that I would have is, if you have a lung disease and you feel that you can't wear a mask because it's either uncomfortable or you feel like you can't breathe, you really have to question your activities of being out, because you're also not only exposing yourself, but you're exposing other people potentially by not wearing the mask. So that's when we have to think about helping each other in community. So if you're somebody that says, I can't really wear a mask, but I need to go do some shopping, you know, fortunately there's a lot of stores that are looking at, you know, we'll bring it out to you. You can order ahead of time so that you limit the amount of time that you're being exposed to other people, so that you're not exposing, you know, yourself and others to the possibility of you know, COVID. And as we go into flu season, you know, that's certainly going to help us as well, you know, doing the hand washing, being able to wear the masks. That's also going to be able to help us in bringing those numbers down.
And getting a flu shot.
Exactly.
If that's something that's consistent with your belief system.
Yeah, definitely getting the flu shot is the one way that we know that we'll be able to work. And we're working right now on developing our communications as well, as to how do we communicate once the COVID vaccine is out. How do we get so that people are able to have access to it, understand what it is, what are the associated benefits and risks, and who are the people that should be first in line to be able to,
that's right,
to get that vaccine.
Well, you preempted my last question, because I was going to ask you about what is going to happen from, you know, ALA's direction in getting some of these messages out to people. And you already went there. So thank you so much for that. And thank you so much for spending time with me. Always a pleasure to talk to you, and especially about something that is so incredibly vital to our very being. We can't live without breathing, but to do breathing well and to do it in the era of COVID takes a little bit of practice and takes a little bit of forethought. And you've given us many things to think about. Thank you so much, Pedro.
Thank you, Beth-Ann. It's been wonderful, and it's always really great to see you.
You too. Pedro Haro is the Executive Director of American Lung Association in Hawaii. And thanks so much for being so forthcoming with so many good ideas that are so simple to be able to put into daily practice and hopefully decrease some of the anxiety that we may be feeling. Thanks to you for joining us today too for another episode of From Anxiety to Clarity. And if you have an idea for an episode that you'd like to see, please let us know. Or if you have a question, let me know that too. You can reach me by email at Kozlovb, that's K-O-Z as in zebra, L-O-V as in Victor, B as in boy, at sutterhealth.org. and we'll get you an answer, or we'll consider what your query is about an episode we might do. You never know, you just might see it. We hope so. And we'll look forward to seeing you next time on From Anxiety to Clarity. I'm Beth-Ann Kozlovich. Thanks. Aloha.